What are the investigations to be done in a case of hydrocephalus, lumbar puncture, and CSF culture to exclude meningitis? And if there is positive culture or turbid CSF, the shunt is contraindicated until clearance of the CSF. Fundus examination is important in a case of hydrocephalus or increased intracranial tension. The presence of chorioretinitis suggests intracranial infection as congenital toxoplasmosis. Papilledema is usually absent in infants but is observed in older children together with headache and vomiting, projectile vomiting. Diagnostic imaging is very important in a case of suspected hydrocephalus. Cranial ultrasound is safe and a bedside. It is useful as long as the anterior fontanelle is still open. CT scan is rapid for acute hydrocephalus. Localize hemorrhage in emergency situations. Differentiate communicating from obstructive hydrocephalus. MRI is very important in hydrocephalus, especially in detecting the ventriculomegaly, periventricular edema in cases of CSF permeation as in the upper image, the presence of the etiology of hydrocephalus tumors, localization of the tumor as in the middle MRI, the cerebellar tumor, follow-up after shunt placement or any symptom if shunt malfunction is suspected. What are the treatment options in a case of hydrocephalus? Of course, if it is due to meningitis with positive culture, wait until clearance of the CSF. You can do repeated ventricular tap through the anterior fontanelle. Treatment of the cause as excision of a tumor if appropriate. The other treatment options are surgical. The most common treatment for pediatric hydrocephalus is ventriculoperitoneal shunt. Insertion of a shunt surgically. The shunt is one-way valve, has a proximal catheter drain from the dilated ventricle and a distal catheter drain in the peritoneum. This is the upper left one is a conventional catheter, and there are programmable shunts which is very expensive and needs experience. The other surgical option is the third ventriculostomy, endoscopic third ventriculostomy. It is doing a fenestration or an opening in the third ventricle to directly drain CSF around the brain. What are the shunt complications? Infections, very important, include wound infection, meningitis, ventriculitis, peritonitis, and infected shunt apparatus. The management is removal of the shunt and reinsertion or reversion. Other complication, mechanical shunt malfunction, with reappearance of the symptoms of increased intracranial tension includes shunt occlusion, swelling at the site of shunt chamber, like this swelling in the subcutaneous tissue behind the ear, the site of the valve itself or the one-way valve, disconnection of the valve and fracture, migration, improper placement, and overdrainage. Other complication is overdrainage. It can cause symptomatic orthostatic hypotension, subdural CSF collection, slit ventricle syndrome with paroxysmal appearance of the symptoms of severe headache due to occlusion of the ventricle and then obstruction, craniosynostosis, and loculation of the ventricle.